going to give it a couple seconds because there's usually a delay here. Good morning, everybody. Welcome to PT on Ice. I'm Jessica Davis, coming at you at Point Park University in Pittsburgh, Pennsylvania. We had a sunny day. It was fun walking across downtown carrying my table this morning. At least it wasn't raining on me. Today we're going to talk about posterior hip pain in the dancer. So I took this topic, it's a little bit different in the fact that you're not going to see that often in the dancer, but when you do, what I wanted to go over is a little bit of differential diagnosis and things that you should consider when you're working with your dancers. So remember, when you're working with dancers, that there are common positional faults and things that you will see muscular imbalances that are a little bit different and unique to this population. So what you're going to see is, again, that hypermobility aspect. So you always have to rule in or rule out hypermobility in the lumbar spine, as well as considering what type of aspects in the hip that you may discover when it comes to posterior hip pain. So if a patient comes to you with posterior hip pain, so the first thing you want to do is think about, okay, what are my differential diagnoses? What might refer to this region, right? So first and foremost, you have to rule out the lumbar spine always. So consider it a lumbar spine issue until proven otherwise. Meaning when you do your active range of motion, you end, and if it's pain-free, you're going to do overpressures in each position, as well as doing your segmental analysis, and making sure that you're really refined in your PAs and UPAs and really clearing the area, because I would be highly suspicious that it would be a lumbar issue. Now, why would that be the issue in a dancer specifically? Remember, they have hypermobility and they have a tendency to overextend in their lumbar spine, and they have poor motor recruitment in their abdominals, surprisingly. So if you look at the research, one of the main things that you're going to see is that dancers lack that motor recruitment in their core musculature. So they're going to come up with some compensatory mechanisms, and they may tell you when I do an arabesque that I have my low back pain, or not. They won't say low back pain, they may say I have buttock pain. And so you need to differentiate and have the patient go into that arabesque position and observe their movement. So functional assessment is key. Now, other areas that you may find referral to the buttock would be the sciatic nerve, right? Also the pudendal nerve, often forgotten, but you can't ignore that one. So that one you're going to rule out or rule in based on your subjective exam. And I'm going to show you a palpation technique that I do to also assist with differentiation. And then it could be a hamstring issue, right? With dancers, what you're going to find often is that they have a proximal aspect of the hamstring that's going to be involved. Now, proximal issues are more difficult in terms of rehabilitation, so that's a whole nother topic. But when you're working with your dancers, you have to remember that this injury, if it ends up being a proximal hamstring issue, it can take some time, and it's frustrating because they want to get back to that explosive type movement, grand jetés and different jumping activities and even splits that they're going to have discomfort with. So just different things to consider. So when you look at going through the exam, you're of course going to do your objective, and you're going to start with the lumbar spine, clear that lumbar spine. Then with the hip, now even though it's posterior hip pain, most often it's not going to be an interarticular issue. However, you still need to do all of your hip clearing exam, specifically your Fader test, Faber, and then getting into the scour and end range overpressure in each position. Now, in the hip with the dancer, remember, they tend to have, on average, an additional 20 degrees of external rotation compared to others. And they also lack that internal rotation. So the hip in the dancer has been compared to the shoulder of the pitcher. So with that, they often will have strong external rotators and very weak internal rotators. So that strength assessment is going to be key because you may be dealing with more of a muscular issue that's contributing to that buttock pain. So definitely consider that in your exam. Now, I wanted to go over a test because the other thing that you could have is an ischiofemoral impingement that can cause that buttock pain. So there's an IFA test that you can do in side lying. So I wanted to review that with you so that you can help differentiate, is it a posterior impingement type issue compared to another issue as well. So I'm going to have Amber lay down here and I'm going to figure out this camera here. All right, let's make sure we can see the table. Awesome. Okay, so hopefully everybody can hear. I'm gonna yell a little bit. Okay, so when you have your patient in sideline, what you want to do to differentiate if this is a posterior hip issue is if you take the patient in an adducted position, yes, so not externally rotated, adducted and slight internal rotation, this is IFA test, then you're going to bring them into extension. And so if the patient says, that's my pain, what you want to do is then take them back into flexion, combine a little bit of adduction and external rotation, and then bring them back into extension. Now, what you may experience is you'll feel a little freedom of movement because this is more of an open pack position of the hip. But what you're looking for with this test is, does that alleviate their symptoms? So if they have pain in an adducted and internal rotation position and you bring them into extension and that reproduces their buttock pain, consider that it could be an issue of femoral impingement posteriorly that you may need to address. So treatment for that would be addressing hip flexor hypomobility, right? And we've talked about, assessing in the dancer, they often over-recruit their hip flexors and they're tight, so checking if they have some imbalance in that region, but also retraining and educating hip abduction and external rotation. So what can often happen with the dancer is that they're going to have pain with the arabesque. So I'm going to just have Amber show an arabesque again for those of you, just to review what that position is for you. Okay, so I'm going to flip this around. Somehow here, oh yeah, this is better. Okay, Amber, so go ahead and do a really good arabesque. Okay, perfect. So this is absolutely perfect. So what we're looking for when they do the arabesque is considering you're going to get a degree of lumbar extension, you're looking at that hip external rotation as it comes around. And I would look at, kind of multi-angles. Are they getting, another thing that you're going to see sometimes with an arabesque is a compensatory side bend. Now, she does have a smidge of that. So that's something I may, she corrected. But she may have that. So just consider, what are you looking at, right, in your dancer that might be contributing to a complaint of buttock pain, right? So come back out of that. So what I want you to do, Amber, is go ahead and do like a little bit of like excessive like extension in your lumbar spine, and maybe internally rotate. Yeah. Good. So see that? Now let's look from the front angle here. See what she does there, a little bit of side bending. So even from the frontal aspect, we can see a deviation here. Go ahead and correct that now, Amber. Yes. Okay, so that's something that you're going to look at. Now, often with dancers, thank you, I'm gonna have you on your side. So with dancers, the other thing you're gonna find in the literature and when you're working with them is that they tend to have over-recruitment of their hamstrings and they don't engage their glutes. So if you recall in previous episodes, I've talked about doing a little bit of PNF, and I've combined that in previous ones where we're talking about that groin pain and its contribution when the patient does a développé to the side and they get that groin pain. The same applies when they do the arabesque. So what I want to show you is how to recruit the glutes and then combine that with an arabesque position, and then how we can do that transferring it off the table. Okay. All right, so go ahead. Good. So when you're doing this, you want to make sure that you're not facilitating a rotation of the trunk. So remember, you kind of just come on a diagonal, imagine a diagonal happening in the pelvis, and you just sort of push and observe from different perspectives what happens. So if I come posteriorly, I get a lot of trunk rotation. I don't want to re-educate that because we could see when the patient does the arabesque, I don't want to facilitate a side bend and I don't want to re-educate into a rotation. I want to educate extension, but keeping this neutral, right? So it's important when I educate that I have my proper hand placement, that I'm not incorrect with this. So I'm going to kind of find where I want with my patient, and I'm going to have Amber, don't let me move you, fight me here. So this is facilitating her abdominals. And then I'm going to come back posteriorly and resist. Now I'm going to get the camera and get a little closer so that you guys can see. I'm going to do it with one hand. I never would do this with one hand, but just for viewing purposes, I want you to see what I'm doing. Okay, so let me show you what's happening here. So depending on how I push her, watch what happens with her trunk. If I come here posteriorly, see how she gets a lot of rotation? That would be not a good way to re-educate, okay? Because I'm going to encourage that rotation happening, so I don't want to do that. But what I want to do is just find that magic angle that when I resist, I don't see much trunk movement. See how she's not moving much? So that's the angle, this angle right here, that I'm going to be doing my resistance, okay? So what I would do to facilitate that glute activation is I'm going to say, don't let me move you. Good. Now what I want you to do, Amber, push back into my hand. Push, push. Go, 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 go. Good. And relax. So I can start with that. So I can start with just some isometrics, then we can do some concentric. I can even do some eccentric resistance. Now push back into me. Now hold it there. Now slowly let me bring you back. Slow, 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 slow. Okay? So I can resist her that way. So then we're going to move, and I'm going to move the camera so that you can see the full position. So once the patient demonstrates an awareness of what I want at their, let's see if you guys can see here, at their pelvis, I need to make it functional because the patient's not telling me that they have pain and sideline. They need to be able to do their arabesque. And what they might be doing is over-recruiting this hamstring and forgetting to use these glutes. So I want to re-educate that. So I'm going to come back, find that angle. Good. Hold that, Amber. Now I want you to push back. Push. Good. Hold that. Now, my resistance is going to be posterior. Where my hand placement is essential with this because it's going to stimulate the muscles that I want to recruit. I don't want to have my hand here. It will confuse, it will be a confusing tactile cue. I want to be back. So I'm going to come down, get my good body mechanics. Now what I want you to do here, Amber, is I want you to go ahead and get into that arabesque, but I don't want you to let go. Do not let go of this. Push back. Go, 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 go. Now the resistance that you're going to give is X minus 1. What that means is you're going to let your patient win, but you're really, really fighting them basically. So you're giving them a workout. Now what I want you to do here, so that was a concentric, so I could have her slowly let me bring you back down. So we may be doing several sets of that, right? So I'll just come back in here, find this. Good, push down into that hand. Good, keep that. Now I want you to push this back. Go, 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 go. Excellent. And then I can even get distal with my I can go farther down, right, with this hand, and I can give her some resistance. Go, 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 go. Don't you let go. So pay attention to your proximal hand. Now the other thing you might not see from the camera angle is with this hand here, I've got it in my abdomen so that I completely have control of the patient. She's not going anywhere, but I'm paying attention to what I'm feeling in this hand because I don't want her to let go of her because then I'm not educating how I want. So then we need to get this more functional. So let's get her into standing. So come on over to the ballet bar. And this might be a little tricky. We'll have to get creative with my camera. Okay, how about, yeah. Okay, so what we're gonna do, I'm gonna have you get into, flip this over here. Let's get into an arabesque, but sideline. I mean, not sideline, but on your side. Actually, that's not a bad idea. That's kind of a controlled position. Okay, good idea, Amber. So I like what she came up with because if she has one arm at the bar, so facing sideways, if she's like this, right, she only has one arm to have assistance. So that's going to be more of a challenging position to educate, right? So not a bad idea to turn her this way so that she can really focus on what's happening here, which is what I want to address, right? So what I'm going to do, even though this patient's standing, is I can get down here, so come back into that first. I can come back down here and guess what? I can still work on getting that recruitment that I want here with my hand placement, right? So right up under, and I'm kind of facilitating in a up an anterior type rotation resistance position. So I'm getting that. Now this is, again, not ideal because I don't have, if somebody was videoing this for me, it would be a little bit better for you guys to see, but I really wanted you to see up close. So I'm gonna be here and then I'm gonna say, okay, Amber, come on. Thank you. So I really feel that, and then I've got to get out of her way so that she can get into that arabesque. Go, 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 go. Okay, and then come back down. Now, what am I going to be paying attention to? what's happening up here. If I see that I'm encouraging a side bend or she's getting some extension, then the fault is mine. I don't have the right hand placement. So it's not your patient's fault, it's where you put your hand that means everything. So maybe you want to come up to the side and change your angle a little bit, because remember, everybody's anatomy is different, so you're going to see a variety of things. But you can transition that into a functional activity, right? Then where that would go is if you had a ball and you could teach the patient to push their hip into the ball, engage, and then work on finding that arabesque type position without over-recruiting that hamstring. So they'll start to feel that and they'll learn what those glutes feel like when they're properly engaged as compared to an over-recruitment of the hamstring. So I hope that helped. So remember, with the dancer, don't forget, they have a tendency to be hypermobile in their lumbar spine, so you have to clear that. You want to always look for those subtle deviations because they're very, very good at coming up with compensatory patterns that are subtle that you may not see. And then remember with the hip has that extra external rotation in the dancers, and they often are lacking in internal rotation, especially in strength, but they also have the tendency to over-recruit their hamstrings. So if you get a dancer with buttock pain, and then last but definitely not least, do not ignore the sciatic nerve contribution to it. So tease that out. Make sure you're not having some additional element of adverse neural tension that you may be dealing with that could be contributing to their pain. Okay, all right, I hope everybody has a wonderful day. Don't forget, check out ptonice.com, and you know what, in April we have the ice sampler platter where everybody's going to be there. It's going to be, I'm so excited. It's going to be absolutely exciting. And I highly encourage, if you haven't signed up, sign up, come meet everybody, learn from the best of the best. I mean, everybody that's going to be there is absolutely awesome in their field. So have a wonderful day.